Okay. My name is Dimly. I'm the nurse practitioner from US University. Today I will do the abdomen exam on my patient. Before I get in the room, I will review his chart, gather all the supply, wash my hand, and provide privacy for him. When I see the patient, I will introduce myself and identify the patient and ask him for the consent. Um, okay. Hi, how are you?
Pretty good.
That's good. My name is Lee. I'm an MP student from US University. Today I will do the abdomen exam on you. Is it okay you allow me to post the video on YouTube so my instructor can see it?
Yes, you have consent.
Okay, thank you. Can you tell me your name, your day of birth?
My name is Tino Chan. My date of birth is 8/2/1972.
Okay, that's good. So now, before I start to do the abdomen exam on you, can you help me relax? Okay,
Sure.
are you comfortable?
Yep.
Okay. So can you help me pull up your shirt?
Yep.
Alright. Okay. So the first step I will do is I will do the inspection. So I will inspect his skin to see any, like right now I can see like no sclera, no chondai. I will inspect the shape. It's a little bit brown and it looks smooth. It's no scar. It's like no bulging. And I can see like the wave of abdomen, so no peristalsis. And I will inspection the umbilicus, no bruising, no redness, no rash, and no hernia. Okay. So the second step, I will start to do the auscultation, so I can listen to the bowel sound. Um, I will divide the abdomen to four quadrants, and I will start from right upper quadrant to left upper quadrant, go to left lower quadrant, go to right lower quadrant. So with the bell, I will listen to the sound. I will listen to the fluid. Like if have a no fluid, it means no obstruction. Um, so I will start to um, listen to the abdominal aorta right here, and then I listen to the renal artery, iliac artery, and femoral artery. So the normal bowel sound usually 5 to 30 per minute. Okay, I start listening to your. I will start listening to the aorta and then use the bell and diaphragm. Okay, I didn't hear any fluid. It means he doesn't have any obstruction. And the next step, I will do the percussion. So when I do percussion around his abdomen, I will look for the sound. Usually have a two sound, like normal to hear the tympanic sound, and it's not normal if I hear the donut sound. Donut sound usually is for the it show the patient have a some abnormal or organ fullness. So I will start to okay. So it's good when I hear all the tympanic sound. So the next step, I will do the percussion on the liver. So the purpose of the liver percussion is so I can measure the liver size. I will use the mid-clavicular line and I percuss downward from the area of resonance to the area of donus. And after that, I will do the percussion upward from the area of resonance to the area of the donut mark and measure the distance between these markings. So usually the normal mid-clavicle line usually 6 to 12 centimeter and mid-sternal line usually normal 4 to 8 centimeter. So, okay. So this look like he have a 7 centimeter. Okay. The next step, I will do the percussion on the string. So it's a little bit harder to do the percussion on the string because it's like laid deep below the rib cage. So I will start in the left upper quadrant above the ninth intercostal space in the mid axillary line, and after that I percuss like toward downward to find the lunus, not over the sling. So normally the area of the splenic lunus usually located between 9 to 11 intercostal space and less than 7 centimeter wide. Um, but it's normal not to hear the lunus. Okay, all right. So the another step, I will start do the palpation. I will do the palpation for 4 quadrants. Uh, First, I will apply the light palpation first and then deeper. So I can try to see if the patient have any mass or tenderness area. So light palpation usually done at the deep of 1 centimeter or you to check for the lamp masses, pulse, involuntary muscle gathered, or the tenderness. So I will apply only 1 centimeter. I'm sorry, it's cold.
A little bit cold.
Okay. Okay, I will apply some light pressure. Okay. Light. And you tell me if um, you can discomfort somewhere. Okay, you can stop me right there. usually done at 5 to 8 centimeter. It is performed to determine the size and location of organs and to check more for any masses or rebound tenderness. So in healthy patients, this palpation usually enable I can feel the liver egg, aorta, and the sigmoid section of the colon. So now I will apply some deep palpation, okay? So you will feel more pressure. You tell me you you pain or discomfort. How was it? You
No, no.
okay? So the next step, I will do the palpation on his liver. So the liver, as in normally palpation, uh, palpable in the right upper quadrant, just below the costal margin at the mid-clavicular line. So only in large liver is palpate more than 1 to 2 centimeter below the right costal margin. Maybe take a deep breath. You have any pain?
No,
Any discomfort?
no.
Okay. So the liver was palpitation with inspiration and no pain and no discomfort. And the next step, I will do the palpation on the spleen. Begin palpation in the left upper quadrant, well below the costal margin, and attempt to feel the spleen while palpate upward toward the costal margin. So normally the spleen is not palpable. You okay?
Yep.
Tell me if you're in pain or something. So the spleen is not palpable. It's a good sign. So it's not enlarged. Okay. So I will perform some special tests. First, I will do the Murphy sign um, to check if the patient have the cholecystitis. So usually I will put my hand in the middle inferior border of liver, and I ask the patient take a deep breath. Then you deep breath when I do that step. Not now.
Oh, okay.
I will do it after I explain. So if positive, the patient will experience pain and it will stop uh, short of full inspiration. So I will apply the pressure around this area and just tell me when if you in pain, just tell me stop, okay?
Okay.
Help me like take the deep breath, okay? Are you okay in pain
Yep.
or no?
No, no pain.
Okay, that's good. So that's the Murphy side. These have a negative Murphy side. The next, I will do some tests for appendicitis. First, I want to look for the McBurney point. Uh, McBurney point is usually between the umbilicus and iliac cervical bone, so in the middle. So it's right here. So if like I press and if the patient in pain, it will show like the patient have a appendicitis. So I press. Let me know if you in pain, okay?
Yep.
Are you in pain?
No.
Okay. So another test to check for the appendicitis, I can do the uh, Rosenstein. It means I put the pressure on the left lower quadrant and you will feel pain on the right lower quadrant. Uh, if you do have appendicitis, okay? So I will apply the pressure here, and if you feel pain in this area, and let me know, okay? How's it? Okay? All right. So another technique I can tell him to, um, I will, can you lift your thigh up, okay, and push against my hand, okay. So if you do like this, and to see if this area like have a pain or not.
No pain.
Okay. Can you do this side? Okay. How about this area?
No pain.
Okay. This means he doesn't have any appendicitis. So the next step, I want to perform a test to check if the patient have a ascites. So he doesn't have a ascites. It's just like to perform the test for education. So I will use the test called shift fluid. So I will turn the patient aside, and I will percuss like from the top of abdomen go down because of the like the gravity. So like when I turn the patient, the fluid will go to that side. So on the top, I supposed to hear the tympanic sound, and then go down, it will hear the donor sound where the fluid at. I can like do the same way to another side, and I will hear the tympanic on the top and the donut at the fluid side. So um, now I want to turn you to another side, and you do slowly. So I will push from here, go down here. Okay. So if like he have a sinus, so the fluid around this area, so I will hear the donut sound. So okay, and you careful. Okay, and I will do the same technique to this side. Okay, can you turn around this side?
This side.
Yeah. Okay. So on the top, I will hear the tympanic sound, and I focus down, and then around here, if you have a ascites, I will hear the boom sound. Okay, you can lay down. How is it? You okay?
Yep.
You comfortable? Okay. So the last, so okay, the next step I will assess for the CVA tenderness. CVA tenderness, I usually we're looking for kidney stone, pyelonephritis. So CVA, like the angle form usually at the 12 rib and the vertebral column on the posterior thorax overlay the kidney. So if it have a CVA tenderness, it indicates a potential kidney stone um, and pyelonephritis. To test for this, I will ask the patient sit up, and I will apply like my palm, and I apply I focus with a fish in another hand to see if the patient in pain or not. If he if he complain pain, this means it will be have a positive CVA test. It show the patient have a kidney problem. Okay, so right now I will want you sit up slowly. Okay. When you sit back, Can you sit back a little bit? Press it up, right? So I will apply some. You will need some pressure, okay? You cold? Are you in pain?
No.
Okay. Same. You in pain?
No.
Okay. You feel okay?
Yep.
Okay. So okay, it's okay. You don't need to sit down, lay down anymore. So you don't have any like um, CVA tenderness. Um, so now I finished my abdomen exam. Do you have any more questions for me?
No, I really don't have. I just feel fine.